Hi, my name is Jenny. I'm 36 years old. I'm a physician assistant in New York. I've been a physician assistant for the past 15 years. I've worked in numerous hospitals throughout New York City and Long Island. The first 7 years of my career I spent in emergency medicine, and the last 8 I've been in critical care medicine. The first thing that comes to my mind when I think about or I'm asked about the COVID-19 pandemic is that it's like nothing I've ever seen before, um, in so many ways. From the severity of patients, the severity of illness, from the number of patients we're seeing, um, the lack of unpreparedness on the part of our government, the lack of unpreparedness on the part of the entire healthcare system, um, the struggles that we as frontline staff are facing, not just nurses, doctors, PAs, and Ps, but also grocery store workers, firefighters, policemen, everyone out there on the front lines. No one was prepared for this. We live in New York, the greatest city in the world, and somehow we found ourselves faced with this pandemic with not an ounce of preparedness. Um, and it's affecting us in ways we never thought imaginable. Um, from going to work and worrying about whether or not you're going to have a mask to wear that day, from worrying about how you're going to watch a patient pass away without a family member able to see them because visiting hours are restricted, worrying about how you're going to support your fellow coworker that day that you know is on the edge of having a breakdown, how you're going to go home to your loved one and act like it's a normal day and not bring home all the negativity you're seeing to your partner or your family member, worrying about giving the virus to your family member that you live with, not being able to see our loved ones because of the quarantine, and even being afraid to go home to your own home because you know you're working in a unit that's entirely COVID-19, and knowing that you're exposed and now coming home and making sure you're keeping your loved one safe because you see what it looks like to be a patient in a bed every day, and you don't want that for yourself and you don't want that for your loved one. When this first started, I thought it was going to be nothing. I remember hearing about it on the news and thinking, well, that's in China. It's not going to get here. No way. It's halfway across the world. It's just a virus. We see this all the time. Those people in China must be dying because they're old. They're not getting good health care. This is a fluke. I actually had a trip booked to Aruba before this all started. And I remember me and my boyfriend were talking about it up until a few days before we were about to leave, but what we were going to do. And he was like, we have to cancel. I don't think we should go. It's going to get canceled. It's going to get canceled. And I was like, no, come on. It's not going to get canceled. This is the United States. This is not going to happen to us. We were due to leave on a Wednesday or a Thursday, like March 19th. And I went to work on Sunday. And I remember getting to work and opening up my work email and seeing an email there stating that if we travel to an area that was considered a level 2 health advisory, we would have to quarantine ourselves for 14 days upon returning, and we would not be allowed to work, and we would not be getting paid for those 14 days. My jaw hit the floor when I saw that email. I've never been told that in all of my career, and I never would have imagined I'd ever be told that. And I was upset. I was angry. I was like, this is not happening. I'm going to Aruba. This is crazy. And I texted my boyfriend right away and I told him the news, and we had no choice but to cancel at that point. And that was the moment that I realized this was serious. That was the moment that I realized that our life was about to change in ways we never knew imaginable. We canceled our trip, went on with my, work, and it took about a week after that where we started seeing some changes at work, patients coming in slowly. We were ruling out patients. And then I started to panic because now I knew it was near and I knew it was close to home. I remember going online and searching for any ounce of PPE I could find. I bought masks, I bought isolation gowns, I bought goggles, I bought face shields. I started to panic. I was panicking that we weren't prepared. I was panicking I was going to be on the front lines and I wasn't going to have what I needed. And I had no idea, what to expect. And I almost felt a little silly and stupid because I was that person who said, this is not happening. This is not happening to us. And here I was panicking, buying everything. My trip was canceled. And sort of, biting my tongue in that moment because I kind of felt silly that I was the one telling everyone this is going to be okay. And now I'm in the exact opposite position where I'm telling everyone we're not okay. I'm telling everyone out there to stay home, to be safe, to follow what the governor and mayor and president is telling us, to quarantine, to stay home, to go out only for essential reasons, to keep your family members safe. I'm sharing my stories, what I can share without violating any HIPAA laws out there. I'm trying to share my stories with my family, my friends on social media, so they can get a glimpse of just how serious, this is. I'm going to work every day and I'm watching people die that shouldn't die. I'm getting overwhelmed with patients that we can't care for, that we don't have resources for, that are dying alone without any family members there to hold their hand or say goodbye. And the family members that aren't getting that comfort, that human touch, when their loved ones passing away. It's been hard for us as healthcare workers to understand how so many people could be dying when they shouldn't be. So many people dying at a young age that are dying in record numbers at young ages that we've never seen in all of our career. So I can't imagine how we can expect family members to understand that their loved one is passing away. And that's probably one of the hardest things of all of this, is watching patients in these hospitals alone and worrying about the family members on the other end of the line that can't really comprehend what's going on inside the walls of our hospitals, that can't fully understand what's happening to their loved one. It's awful. And I've never seen anything like this in all of my career, and I hope that once this is all over, that I never have to see anything like this again, because it is truly heartbreaking. Yeah, it's heartbreaking.